Hi and welcome to the Dental Surgery, your home for dentistry. Today I'm going to just demonstrate to you how to use some interdental brushes. Obviously every mouth is different and not every mouth is like a model, so we would always demonstrate this in your own mouth when you come to visit us, but just so you have an idea if you want to start at home. So interdental brushes come in all different sizes. The thicknesses, generally what they are is a plastic coated wire with a little bristle brush, and this works to clean in between the teeth, removing food and plaque. The thinnest one you can get, like this tiny little pink one, will normally fit through teeth quite comfortably. And what you're doing is finding that space and just popping through like this. Okay, a few times, you rinse and clean the brush as you go along. Now if the brush is too thin, it's not going to work very well for you. So there are some areas that you might need something thicker, like this, okay, and where you find you're going through like that, it's much snugger and will work a lot better. Now some people find these brushes a little difficult to use around the molars. They have designed ones with longer handles, and that makes it a lot easier to get through to the bags. And hopefully you will find that actually in some areas it's easier than flossing, and it's a lot more effective if you can fit one of these brushes through. There's lots of designs, there's lots of makes of these brushes. You will be able to find one that works for you. Initially, when you start using these brushes, you'll probably get some bleeding from the gums. You're getting into where there's some gum inflammation. By regular cleaning, it will stop the inflammation, get your gums healthy again. You want to use these brushes once a day. The best time to do it is probably at night time, just before you brush your teeth. This removes the plaque and the food that's accumulated in these spaces through the day. If you don't remove it, it's left through the night. Through the night, most of your saliva glands shut down, so your mouth is quite dry. You'll be leaving plaque and bacteria in between the teeth, which is not good. Your dental hygienist will help you find a routine and the sizes. You know, this is just a demonstration. It's not a substitute for an actual clinical demonstration in your mouth. So if you try these brushes and you find them difficult, just come and see us. We will make it easier for you. But interdental brushes might not be for everyone. They might not fit. If your teeth are too tight together, then floss and tape will be your only option. We hope this has brought you closer to your TDS smile. If you have any questions on the routine of what you've seen today, you can drop us an email on the link below. Thank you for watching. Goodbye.